there.
Okay, ma'am.
All right. So if you've read and understood, considering its surgical pathology station, please tell me what would be the provisional diagnosis you would consider for this patient?
Okay, ma'am. Considering the scenario,
Yes.
this may be a case of polytrauma patient with a disseminated intravascular coagulation.
All right. Okay. Can you define disseminated intravascular coagulation? What it is?
It's a pathological consumption in which
Yes.
there is the activation of coagulation and fibrinolytic system
Yes.
that leads to formation of microthrombi in many organ of the body that conjunct the clotting factor and platelet that is characterized by diffuse hemorrhage and the thrombocytopenia, decreased fibrinogen and increased fibrin degradation product.
Products, right. All right. If you could tell me what might be the functions or what are the functions of the platelets in the normal
Okay, at
situation?
first the formation of the hemostatic plug
Yes.
by the adhesive and cohesive function, and second the activation of the coagulation mechanism.
Right. Good. Can you tell me how these platelets are formed in the bone marrow?
It's the platelets are formed by the megakaryocytes by fragmentation process.
Okay. Considering the scenario, she's febrile and her vitals are given here. At what grade of shock would you consider this patient to be?
It's maybe the septic shock,
Yes. What grade?
grade 4,
3 to 4. Yes.
3
All
to
right.
4 years.
All right. This patient was planned to move to intensive care unit. Please tell me what is the criteria to move the patient to ITU?
If the patient having the multi-organ failure,
More than 2, yes.
more than 2.
And patient needs one-to-one care and okay. This you could tell me later on. If you could tell me how should this patient be managed now?
Okay, this patient have to manage by multidisciplinary approach, general surgeon, orthopedic surgeon, ICU specialist, and we'll do the shift the patient in the ICU
Yes.
and manage the patient according to the needs.
Okay. Right. Since patient is in shock, patient would have bleeding tendency. So, what might be the reason?
Yes, the patients have the coagulation disorder
Why?
because patient is a hepatitis C patient.
C. Yes, very good. So, what are the clotting factors which get affected because of the involvement
Yes,
of liver?
it's a factor 2, 7, 9, 10.
Very good. Okay. All right. Two situations because of. All right. Okay. There could even be cirrhosis or because of hepatitis C or hepatocellular carcinoma. These are the two
Right.
complications which can lead to. All right. Which pathway would be affected? Coagulation
So,
pathway?
yes, intrinsic and extrinsic pathway.
Both can be affected, right?
Yes.
Okay. How would you determine by doing a prothrombin test? How would you determine which pathway is involved?
Yes, prothrombin time by will detect the extrinsic pathway and APTT for the intrinsic pathway.
Okay, right. If blood transfusion here was okay, blood was transfused to the patient, right? But I want you to think that okay, after a while, patient has presented maybe like this. Could that be that patient has hypersensitivity reaction
Reaction.
to
Yes,
yes?
ma'am.
So which hypersensitivity reaction
It's
might have
anaphylactic type 1.
anaphylactic happens right there and then. If it has happened after 1 hour, just say, then which one
Yes,
it is?
after hour it's the cytotoxic type
Okay.
2.
What happens in this hypersensitivity reaction? What happens in cytotoxic one?
Yes, the IgE and IgM and IgG
Okay. So antibodies are directed
against
towards antigens
antigen
which are
reaction.
present on the surface of the cells, right? So
Yes, ma'am.
for the sake of transfusion, what test would you consider doing?
Yes, we'll do the ABO and
Yes.
RS test.
All right. Okay. What is the most safest blood product to be transfused in these sort of scenarios?
Packed red cell.
Okay, packed red cells. What percentage of white blood cells are already present in packed red blood cells?
It's
Packed
less than
RBC.
5 into 10 to the power 6 liter.
All right. Okay. Please tell me what is the average lifespan of the red blood cells?
120 days.
Okay. Right. What happens? Right. You've already told me, but I want you to tell me that what is the immune. Okay. What do you understand by the delayed hypersensitivity reaction, and when does it takes
Yes,
place?
it's occurs in contact dermatitis or graft versus host reaction. It is a T cell mediated.
T cell mediated, right? Okay. What more I want you to tell me? Right. Because of hepatitis C, healing can be also impaired.
Yes, ma'am.
If you could tell me what are the stages of healing that you could remember or recall?
I can't say now.
Okay. First, hematoma formation takes place.
Yes,
Yes.
hematomas.
Then,
Uh,
okay. Right. What more you can tell me? There was a fracture in this patient. How do you think this fracture should be managed?
I'll manage the fracture with the help of the orthopedic surgeon,
Yes.
and the fracture. So, at first, I'll do the X-ray and see the site of the fracture. It
Yes.
may be needs the intermedullary nailing or plate fixation.
Yes. Okay. Right. Thank you. Okay. Thanks.
Thank you, ma'am.
Thank you. Good.